Today, we're going to explore a condition that 90% of you will experience at some stage in your life: hypertension. It's often referred to as the silent killer, and for good reason. That's why I'm sharing 10 science-backed strategies that I always recommend to my patients to help lower their blood pressure naturally, without relying on medication. To fully grasp hypertension, it's essential to understand how blood moves through the body. For circulation to happen, blood must constantly exert pressure against the walls of your blood vessels, much like water flowing through a pipe. Naturally, this pressure isn't always the same. It fluctuates. When the heart contracts, blood pressure rises, creating the top value known as systolic pressure. When the heart relaxes between beats, pressure drops to the lower value, called diastolic pressure. Regardless of the underlying cause, having high blood pressure over time severely harms your blood vessels. In fact, nearly 50% of heart attacks and strokes are directly linked to hypertension. Now let's get into the top 10 ways you can naturally bring your blood pressure down. Your diet plays a major role in managing blood pressure, and one particular eating plan has been proven to reduce it by an impressive 5 to 6 points: the DASH diet. This diet aligns with what most people consider a healthy way of eating, focusing on whole foods, lean proteins, and cutting back on processed foods and excess salt. One of the key principles of the DASH diet is lowering sodium intake. While sodium has been a somewhat controversial topic lately, scientific research remains clear. If you have high blood pressure and want to manage it naturally, you should limit your sodium intake to a maximum of 2 grams per day. A common mistake I see among my patients is assuming that reducing salt means using the salt shaker less. Surprisingly, added salt only contributes a small fraction to most people's daily sodium intake. The real issue: processed foods and restaurant meals, which account for about 80% of the sodium people consume. Take a look at this seemingly healthy Mediterranean bowl, something I'd probably order at a restaurant myself. Believe it or not, that one dish contains more sodium than the recommended daily limit. Let's look at a real-world example of how even a moderate sodium reduction can have a remarkable impact. A few decades ago, Finland introduced regulations requiring warning labels on high-sodium foods while promoting healthier, low-sodium, high-potassium alternatives. They ensured that food remained flavorful, even pressuring fast food chains like McDonald's to introduce lower-sodium menu options. Researchers then examined the long-term effects of these policies on public health, and the results were staggering. Over the years, the country's average sodium intake fell by 30%, while the average systolic blood pressure dropped by 10 points. But the most astonishing finding? In middle-aged adults, deaths from heart attacks and strokes plummeted by 80%, and life expectancy increased by several years for both men and women. However, Finland didn't just focus on sodium reduction. They also encouraged the consumption of potassium-rich foods. This is critical because potassium essentially counteracts the effects of sodium. While sodium causes blood vessels to stiffen, potassium helps them relax. Additionally, potassium aids the kidneys in flushing out excess sodium through urine. Studies indicate that increasing your intake of potassium-rich foods, such as bananas, oranges, sweet potatoes, spinach, and beans, can lower blood pressure by as much as 5 to 7 points. That being said, not everyone should load up on potassium. If you have kidney disease or take medications that cause potassium retention, this approach may not be suitable for you. So before making any major dietary changes, consult with your doctor to ensure it's safe for your health. Now let's talk about exercise. Until recently, cardio was believed to be the most effective way to lower blood pressure. However, new research suggests that other types of workouts may actually be even more beneficial. A 2023 meta-analysis published in the BMJ examined data from 270 different trials to determine which exercises are most effective for naturally reducing blood pressure. The clear winner? Isometric exercises, movements like wall sites and planks, which were shown to lower systolic blood pressure by as much as 8 points. Now, if holding planks and sitting against a wall sounds enjoyable to you, that's fantastic. But for the rest of us, it's important to remember that this study also confirmed that any type of physical activity can help lower blood pressure. Whether it's high-intensity workouts, low-intensity cardio, or strength training, All forms of exercise contribute to better heart health. The key is to find a routine that fits your lifestyle and stick with it. If you're following the DASH diet and maintaining a consistent exercise routine, weight loss is likely another benefit you'll experience. And that's great news because shedding extra pounds is another powerful tool in controlling blood pressure. Research shows that for every kilogram, about 2.2 pounds of weight lost, blood pressure drops by approximately 1 point. Now let's talk about alcohol. Many people assume that alcohol helps them relax, but what they don't realize is that it actually raises blood pressure, especially if you consume more than 2 drinks per day. And if you needed yet another reason to quit smoking, here it is. Nicotine not only increases blood pressure in the short term, but smoking also damages the delicate lining of your blood vessels, causing them to stiffen and leading to long-term increases in blood pressure. Sleep is another major factor. Getting fewer than 6 hours of sleep per night has been shown to significantly increase the risk of high blood pressure. If you struggle with falling asleep, I have a separate video covering scientifically proven techniques to help you sleep faster. I'll link it up here. However, some people sleep through the night yet still wake up feeling exhausted. If that sounds familiar, you may have obstructive sleep apnea, a condition where breathing repeatedly stops and starts during sleep. It's actually one of the leading causes of treatment-resistant hypertension. If you frequently feel fatigued during the day, or if your partner has mentioned that you snore loudly or seem to gasp for air while sleeping, it's a good idea to see a doctor and get evaluated. Now, what about stress? The answer isn't as straightforward as you might expect. We all know that stress affects our bodies, and it's true that short-term stress can temporarily raise blood pressure. But when it comes to long-term or chronic stress, research is less clear. The bigger concern seems to be how we respond to stress, whether it's through unhealthy eating habits, excessive drinking, or smoking, all of which can negatively impact blood pressure. That's why it's so important to find healthy ways to manage stress, whether through meditation, exercise, or simply taking moments to reset. Here's an interesting one. Owning a pet, especially a dog, has been linked to lower blood pressure. In fact, one small study even found that adopting a pet had a greater impact on blood pressure than taking a standard medication. So let's say you're making all these lifestyle changes and seeing your blood pressure drop. What's the ideal number to aim for? And is it possible for blood pressure to go too low? That's exactly what researchers sought to answer in the SPRINT trial. They compared a blood pressure target of 140 mmHg to a stricter target of 120 mmHg in a large group of adults with hypertension and increased heart disease risk. The findings were groundbreaking. Those with the lower target had a 25% lower risk of heart attacks and strokes and a 27% lower risk of death from all causes. However, the more aggressive treatment also came with some downsides, such as an increased risk of dizziness and kidney issues. Because of studies like this, major health organizations have revised their guidelines, lowering the hypertension diagnosis threshold from 140/90 mmHg to 130/80 mmHg. Now, I know this is a lot of information, but don't feel pressured to implement every single change at once. The key to success is sustainability. Small, consistent improvements over time can lead to significant health benefits. So here's my challenge to you. Pick just one strategy from this list and commit to trying it. Leave a comment below as a way to hold yourself accountable. And remember, even if you do everything right, your blood pressure may still remain elevated, and that's where medication can be incredibly helpful. If you found this video valuable, share it with someone who could benefit. Hypertension affects over 1 billion people worldwide, and by spreading awareness, we can help more people take control of their health. Stay curious, stay healthy, and I'll see you in the next video. Take care.